Today at Oakton EMT, we're going to talk about bleeding control and bleeding control management for a life-threatening bleed. Before we actually jump right into this skill, I'm going to talk about some of the equipment and, of course, my lovely assistant today. Today, we have Abby with us. Abby is one of our instructors at Oakton EMT. Now, before we jump right into the scenario, we're going to talk again about a few of the pieces of equipment today that we have. Of course, the blanket to keep your patient nice and warm. The 4x4 is to initially apply that direct pressure when you're trying to stop or reduce or slow that arterial bleed. And then our guest of honor, the tourniquet. So this tourniquet that we use in our EMTB class, in the video that we're making today, is called the Combat Application Tourniquet, the North American Combat Application Tourniquet, the CAT tourniquet. So when you look at the tourniquet, this is exactly how it looks like. You have a red tab here. People are always wondering, why do we have a red tab? The red tab's to remind you when you put it on your patient that the red always goes towards the rescuer. Either you're rescuing yourself, hence you saw the red tab going towards the rescuer's heart, or if you're rescuing somebody, you apply it and you pull it towards yourself. Next two other parts that we'll be talking about is the windlass. This is the rod that's used to tighten the tourniquet after you apply it tightly to the patient's skin, and then the strap that you actually document the time and date of when you actually apply the tourniquet onto your patient. So before everything else, you always want to make sure your tourniquet is game ready so that you can apply this as a single rescuer. Ideally, when you're dealing with a life-threatening bleed, it's great to have two rescuers, one applying direct pressure and holding it, and the other rescuer is grabbing that tourniquet and then applying it. Can the CAT tourniquet be applied by one rescuer? 100%. But in this scenario, we're going to be applying it with one rescuer, and I am the rescuer who's applying the tourniquet. So like in every single scenario, you always want to have your BSI, as well as make sure your scene is safe. So at minimum, BSI is always a pair of gloves. You may have to wear goggles. You may have to wear a face shield. You may actually have to wear a gown, depending on the severity of bleed and the amount of blood that's being gushed out of your patient. Again, we do have an arterial bleed on my patient's forearm. I take my 4x4s, I apply direct pressure. Bleeding has not stopped. So now my instructor is going to tell me bleeding has not stopped, and I'm going to apply that tourniquet. So again, my tourniquet is game ready. Now, when you apply the tourniquet, there's a few literature, a few books, a few readings will tell you that tourniquet ideally is between 2 to 3 inches above the actual bleed. Some of your literature may say 2 to 4 inches. Two things I'm going to tell you: never put the tourniquet on the bleed itself, never put the tourniquet at a joint. You always want to go high. In this case, again, we're going to go a little bit higher. We're going to make sure that we apply the tourniquet directly to the patient's skin. And you saw how I did that. Nice and tight around the skin, wrap it around, reducing all that loose excess strap. Tighten the WINS list until two things happen: the bleeding has stopped and you don't feel a radial pulse. Once you've tightened this all the way, take the excess material from the tourniquet, feed it through, pull your timestamp over the actual fabric of the tourniquet, document the time that you've applied the tourniquet. If you don't have a writing utensil, perfectly fine. You take that patient's blood, write TK and the time of that application of the tourniquet on their forehead, and you can write it on the stretcher as well. In the event one tourniquet does not stop the bleed of your patient, after you tighten it and still the bleeding does still continue, you can apply a second tourniquet. When you apply that second tourniquet, you have to go above the initial tourniquet, making sure the WINS list does not line up with that second tourniquet. Again, making sure this is nice and tight against the skin of your patient. Feed this through, crank this, or keep on winding it until the bleeding does stop. But now we've stopped the bleed. Now we continue on with the assessment. Now we're going to lay the patient down in the supine position. We're going to apply supplemental O2, high flow O2, and we're going to give them a blanket to keep them warm. So I'm going to apply my supplemental O2. I'm going to put my blanket onto my patient to keep them nice and warm. I'm going to secure them appropriately to the stretcher, and then I'm going to take them to the appropriate receiving facility. Now, always remember, once you apply a tourniquet to your patient, the tourniquet always stays on. One thing you may or can do is if bleeding does occur, is tighten the tourniquet again at the windlass, making sure it's nice and tugged, making sure it's nice and tight on the skin. Tighten it until bleeding does stop, and then that's it. Again, always make sure your patient is laying in the supine position. You cover them up with the blanket, you apply your high flow O2, and then you transport them to the appropriate receiving facility. Again, if you like us, follow us on Facebook, Instagram, and on YouTube. Oakton EMT. Thank you and have a great day.